within the structure of the International Society, we have working groups on education, students, telenursing, open source, also e-health economics. Recently, the new working group has been created for teleodontology. We also have an ambassadors program under the guidance of Archbishop Emeritus Desmond Tutu. Their task is to raise the profile of e-health worldwide. And then our annual event, which is an ISFT EH event, Meditel in Luxembourg, which brings people together from more than 50 countries all over the world, a program of 200 where you'll find all the abstracts in PowerPoint presentations since 2002. There are close to 3,500 abstracts, papers, and PowerPoint presentations available, open access, and that's classified per year, per topic, per country, and also a section where we put together the evidence-based presentations. So it's really becoming a source of information, a highly valuable source of information. Again, I mentioned the working groups on education. The networking is essential. We talk global. It means that we need to be in contact with people all over the world. And then you'll find several examples of implementation as well. You can go through that at ease through this presentation. Also, open source, I think, is a very important part to use for the future. So the role of ISFTEH and Meditel are highly valuable as their ability to provide quality expertise and advice, to mobilize specific resources, and to validate the reliability and efficiency of telemedicine and e-health, especially in low resources countries. I thank you very much.
Thank you, Frank, for an excellent colloquium. It is also very, very resource for especially countries who are not so advanced in the e-health. So we'll take up some few questions. We have 2 to 3 minutes, I think. 2 to 3 questions we can take up. So any questions or comment, please introduce yourself. And I request the organizers to give them the mic so that we can hear their questions and comments. You can raise your hands because it's very difficult to find out in a big hall. Yeah, there. Can you give some mic to him so that we can hear? I can take the mic. Okay.
Check. Can you just repeat the question? I'll get a little bit closer to you. Well, I think traditionally cardiology is certainly a very important chronic disease. Diabetes is another one that is already been addressed strongly by e-health. But then you see new fields like odontology, psychiatry. You can name it all. Actually, I think, of course, radiology was one of the initial uses of for telemedicine. But nowadays, you can't do without the modern communication tools anymore. That doesn't mean that it's a new form of medicine. It's just that the healthcare professionals and the patients themselves will get used to a proper utilization of these tools. And I insist on that. The tools are available. The technology is not a problem. But it's the way we're going to use it properly, not wanting to do everything by it. We shouldn't be just blindly believing what a computer tells us. We, the people, have to manage the technology. We should not let technology manage us. And after all, it's about the patient, isn't it? and it may not be said enough, is if it helps the patient, it's good. If it's just to satisfy yourself by playing a tool, no, that's not the way to do. But it appears evident. But from my experience, and I'm not a doctor, and I'm even less a computer person, but from my experience all around the world, I hear that it needs to be repeated all the time. It's about the patient, stupid. Thank you.
I'd add a little bit more, being a doctor, a little bit more information I can provide you. If you ask me what diseases, I think, in fact, all the diseases, all the specialties for medicine are benefited from the telehealth services or telehealth technologies. Of course, e-health is a broader thing, but let us focus on the telehealth. It's a question of what you want to use. What is said, actually, Frank, it is you and I who are involved in the healthcare management to decide what you want. Every day you find a new item coming up in the newspaper, and the latest buzz is going on about e-ICU. That itself shows that, that such advanced care infrastructure cannot be managed in solo. You can network and make an environment where people collaborate to support ICU management in peripheral areas. So any other questions and comments from our audience? Please raise your hands. So if not, I think we'll quickly switch on for the sake of the time. And Frank, I request you to invite the next speaker.
Yes, I think you were told that from the 6 speakers that were originally planned, there only 2 people had to excuse themselves because. So may I call now Gavin Young, Consul General and Trade Commissioner of the New Zealand High Trade Commission in Mumbai. Please, Gavin.
Okay. Good morning, ladies and gentlemen. Very good to see you all this morning, and it's good to be here. Just a question: is anybody here interested in cricket? Yes, a few. It's always hard to know if you're busy with healthcare how much time you've got for cricket. I just hosted a reception for the New Zealand Black Caps test team in Bangalore this week, and I was thinking that if we'd organised it better, we could have had the test this week in Hyderabad and hosted the reception here for the conference. So we'll have to organise that better for next time. So, talking about cricketers, you'll recognise this gentleman, Sir Richard Hadlee, who played here a few years ago. Now, over the next 15 minutes, I'd like to tell you the story of the New Zealand experience in using IT in the health system, and using IT to drive the health dollar further, to improve patient outcomes through public-private partnerships, and to talk about a case study around diabetes, in which we can look at the various parts of the system and the technologies and how they all come together. The New Zealand system is largely publicly funded. It faces the same issues as healthcare systems in other countries around the globe. The New Zealand government, like most others, is faced with the prospect of increasing health spend. In fact, we spend about 10.3% of our GDP on health, and we have some of the same issues that other countries have, not so much India, but ageing populations and some of the health issues that go with that. Now, due to the continuing cost and delivery pressures, New Zealand has innovated in a number of ways and is building an international reputation for the quality of its health informatics offering. This is a result of a culture of innovation and product development that just exists in New Zealand. A small population which is suited to piloting new systems and ensuring they work, and refining health IT systems and high uptake of electronic medical records in the New Zealand health system. Now, just to give you an idea of the New Zealand system, the core health services, both secondary and primary, are delivered via a public health system, so that's about 78% of the healthcare system. And in addition, there are primary, dental and elective surgery that is offered through the private system, which is about 22% of the system. Now, the public system comprises of 20 district health boards who run 23 regional hospitals in New Zealand. Now, primary health care is delivered through medical clinics and private doctors. Policy and health strategy is delivered from the Ministry of Health. Now, increasingly, there's an emphasis on early detection and treatment to avoid expensive hospital treatment later. Now, to run the health system efficiently has required high level of IT enabling and selection of a small range of technologies that provide competitive or a competitive element in their selection, but also at the same time ensure compatibility. So the intention is that all parts of the system can deal online with the same information and records for a patient with appropriate levels of access given as required. Now, as I said earlier, New Zealand is a small population and it's quite dispersed. We've got a few large cities, but we've got a thin population.